Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher, and we are at the 129th episode of the CodeCast podcast. We are well into April, believe it or not, and for some of us, this federally mandated quarantine now has us at day 25. If your state started earlier or later, then you're probably having the same stir-crazy issues that the rest of us are having in the country. But all I can say is thank God for podcasts, because between TV and radio and noise and kids and partners and husbands and wives and everything, I'm sure everybody's either going to be really happy to stay together or they cannot wait to get out when this is finally over. And just remember, I always think of that phrase, every storm only has so much rain. So you know what? It will be over at some point, and there is a light at the end of the tunnel. I know we can't quite see it yet, but I do see a crack in the armor. So hopefully everyone is safe, staying at home as much as possible, and protecting yourself as much as possible. So as most of you know, I've been teaching, presenting, training, eating, breathing, and sleeping telehealth for the past month now. And I started learning this and understanding about telehealth about 5-6 years ago. And that was the old rules. But now the new rules and the updates, I know they're killing me as much as they're killing you, because they keep changing them. And so what I've done is I've had to do a webinar on demand. And so because when we do it live, the next day it doesn't seem to be, as accurate. And so there is one on demand. It's on my website at terryfletcher.net. I update the materials again every 48 hours. My voice is the training, so I am the one training and doing the webinar. And what you may have thought was accurate on March 29th is now changed to April 2nd. So it's been crazy. But if you need the training, I encourage you to order it. Thank you to those who have ordered it. I really appreciate that. We've had a lot of orders for it, but your business is appreciated. But today I wanted to focus not on the coding of telehealth, because you probably need a break from that. I will have one question on it regarding telephone calls, but the delivery of telehealth. Nobody's really talking about that. This is like the worst case of do it yourself, DIY work of anything out there. So just kind of sit back and listen to this, whether I was going to say listening in your car on your way to work, but now if you're listening on your back porch or listening in your house or while you're working in your home office space now with your headphones on, hopefully you can visualize how to facilitate telehealth in your practice and navigate this new normal. I know it's tough, and I know it's not something anybody really wanted to get thrown into, but here we are. And I just want to make sure that you at least have a little bit of direction on where to start. So the first thing is you want to know about the technology, but take into consideration not just your technology, take into consideration what your clients may already have. So develop a process and equipment and connections. That's the first thing. So if you know patients and your population, I know people keep saying that, well, old patients don't have capability for audiovisual. Well, when we're talking about Medicare rules, aren't we talking about people that are over 65? So the older population is what has been really considered in this. And, we're looking at both audio visual, possible just audio only, but you need to know what your equipment and what your connections are, and making sure that you have solid Wi-Fi as well. Now, do you need a telehealth coordinator? I'm actually giving a webinar in the middle of the month, and I'll talk about that later. They're sponsoring this CodeCast today for women in healthcare of Southern California, but we're going to be talking about the healthcare job market. And this is a new role for somebody, so a telehealth coordinator. This is someone that plays a key role in keeping things organized and running smoothly. And you may need more than one, especially with all the telehealth that we're providing. So it could be an existing staff or a consultant. I know myself, I know Tony Elholmes, I know there's quite a few people out there that really focus on telehealth, so something to consider. But that's somebody that can provide technical assistance, troubleshoot for a provider and a client, just all kinds of different things. Also, you might have a telehealth IT person that's basically making sure that the connections work as well. So there's a lot of branches of telehealth. Then implementation. You might want to do a run through before you actually set it up if you haven't already, or continue that just so you know it's efficient. So rehearsal and role plays, testing your system and equipment, training, making sure everybody understands how it works, understand your technical support options. Who can you call? Is it offshored? Is it local? What are their hours? A lot of people have really expanded their hours. My hours, I think they're 24/7 right now. I'm getting calls from clients as early as, now I'm in California, so as early as 4 a.m. all the way up to 11, 12 o'clock midnight. So it seems like I'm working 24/7. Know the limitations of the technology or the mode of communication. Always have a backup plan. So let's just say you can't get a connection for your video, which happens sometimes, especially in some of the non-HIPAA compliant Skypes and FaceTimes and Google Duo, some of those things. So you need a backup plan. Assign staff to assist clients. Make sure that there's somebody there that can assist a client and or a patient that really has some struggles with it, because the last thing the patient wants to do is be upset or cry that, great, this doesn't work either. I'm still not going to get to see my doctor. So how does telehealth impact clinical work? So moving from person to person through telehealth may warrant some changes to your practice. So in emergencies, emergency backup numbers, and then make sure that you're following the same standards as face-to-face care. I'm noticing that a lot of practices are saying, oh, great, now I can call my patient and get a phone call charge for just giving them a normal test result. Or I can call my patient and say, hey, how are you doing? Are you feeling okay? And charge for a phone call. Don't do that. That is not the same standard as face-to-face in the office. And that's what's acting in good faith that Medicare and the relaxed rules have said. Remember, they're not omitted rules, they're relaxed rules. And I think some people are taking advantage of the situation, and we don't want to do that. Provider considerations. So be aware of potential boundary violations. Be professional. So another thing is fully terminate the call or connection at the end of every session. That's one thing I noticed that some practices have figured out, that once the patient hangs up, your end may be still connected. So you want to make sure that's completely hung up. How many times have you had a FaceTime call or a phone call with somebody and you didn't hang up and they heard something you said about them when you're like, oh, shoot, thought I was just saying that to my partner and not just to somebody. It shouldn't have been something that they heard. So you have to be very mindful of that. So make sure that you're, again, acting like they were in the office, that once that visit is done, the patient, then, you leave the room, the patient is left alone to get dressed and get out. That's the same thing with a telehealth visit. Make sure that that whole visit from a telehealth perspective is terminated at the end of the session. Then provider beliefs. Provider beliefs around telehealth can positively or negatively impact the encounter. So I would actually have your physicians and your mid-level providers talk with other clinicians about their experience using telehealth platforms. Find time to practice with your peers, with family or friends, and be mindful of how your beliefs about telehealth could be impacting your work. Some of you don't like it. I don't blame you at all if you're not used to it, but you still have to be there for your patient and deal with it in the most possible way that you can. So just really focus on the positives of it. Use empathy. So really focusing in on the communication. Remember, we always say that it's hard to get a text from somebody because we don't always know what their tone is. Well, two-way video interactive communication, they do know tone, but it's still not the same as being in person. So manage your expectations and the client's expectations around the limits of technology. Also, make sure you're communicating effectively. So slow your speech down, look into the camera, and be animated so that they can, if you talk with your hands, still talk with your hands, but make sure that they can understand you. Just be very focused on that patient when you're talking to them. If you need a scribe in the room to do that, make sure that you do that, which brings us to documentation standards. So document all services and interactions with your patients and clients in the clinical record. Incorporate electronic communications. So document your phone calls. If there's any kind of faxes that come in, scan those in. Any emails, any video clips, any pictures. If they're giving, videos are a little bit different, especially if they're live, because there are some HIPAA concerns there. But anything that they give you related to their care should be kept in that chart. Providers should maintain either electronic or handwritten notes for each session of the encounter. And remember, if it's a time-based code like a phone call, you have to include time. And then these notes should be incorporated into the record once the provider has access to it, if it's not up at the time that they're having that telecommunication. And make sure that you're also documenting the location of the provider and the patient for each appointment encounter. So is the patient at home? Is the patient at a family member's house? Is the patient in the hospital? Because now we can get hospital visits as telehealth. Is your doctor working from your office or working from home? Remember, they relaxed the rules where your doctor doesn't have to list their home office address as an office address or location during the PHE, the public health emergency, as they would have. So remember, any location you practice from, you have to do that, except for right now, they're saying you don't, but you still have to put that it's coming from the physician's home, which for that one would be place of service. What is it? I'd have to look that up for you. I thought it was 32, but you have to make sure that you are understanding that you can't just put whatever you want in there. You have to make sure you put in what that physician's location is and make sure that it's actually there. It'd be 18. So just look at that. But when it comes to the patient being at home then and the physician's at the office, then you're going to get to, if it's not just audio, you'll be able to put in that place of service 11. But that should be reflected in the record. Now, introducing telehealth to clients. Every client should receive an orientation to telehealth communication. So begin the conversation by explaining that telehealth is very similar to receiving services in the office setting. Explain what you're talking about is an office visit that is done using appropriate technology, such as a computer, a tablet, a smartphone, or a laptop or other device. Say, we're going to try to get through this as easy as we can, as quickly as we can, but we want to give you as much information as we can, and hopefully that's on two-way video. It's helpful to discuss how telehealth can be used. So when you're talking to the patient, explain that during social distancing, it is appropriate for visits and other services to take place via telehealth. That's really important for a physician and a patient to have that conversation. Also explain that each visit will begin with a check-in process. So that includes deciding if the visit is appropriate for a telehealth format. It could possibly be just a virtual check-in. It could be a phone call, which would be different than office visit codes. So it's not always going to be put in a telehealth visit. Okay, so just know it. You let the patient know there are other options for telehealth services. And then explain the benefits of telehealth to the patient. Say, so this is because less exposure to illness, including the COVID-19. No need to take time off work if you're able to actually work, outside of your home surroundings. But we want to help you to be able to be seen. No transportation costs. There's money savings on parking and gas. And then obviously you don't have to find childcare or elderly care. But let them know that this is temporary as far as the offering that Medicare pays for it with minimal restrictions. You need to let them know that, because you're going to have some patients, when you tell them that the benefits are, no transportation and all that, which is important to tell them, but you want to let them know that when this is temporary, because when the rules go back to normal, and they will, otherwise it'll bankrupt the Medicare program, that they're going to have to then come in and there'll be limited opportunities for telehealth. But it's a benefit right now to, lessen their exposure. But you want to be prepared. Okay, so considerations. Now, the decision whether or not to engage in telehealth, that rests with your patient. It's not something you can force them to do. They may not have the ability to engage in telehealth because of maybe cognitive functioning or other limitations. Maybe they don't even have the technology, or they could be afraid of it. And there may be times when a face-to-face encounter is necessary. Just follow the rules with the Centers of Disease Control. There are questions that you need to ask the patient prior to being seen, and then what they need to sign when they come in. There actually is a new waiver now on patients that say, that I wasn't exposed, I don't have it, I'm not sick, I don't have signs. You allow them to come in the office, and let's just say during, then they sign off that they did tell you all that, because it would be illegal for them to defraud you in that and expose your practice. But they I read one that a patient basically did that, said they were fine and everything. They came in, oh yeah, by the way, I used to work for a home health agency, and there's 3 patients that ended up with symptoms of COVID-19, and they sent us home, and they didn't, and that was only 4 days ago. That was a problem. So you always want to make sure you're looking at those principles outlined by CDC. If you are a Coding Corner member, I can give you those. I send them out to almost everybody, but if you're part of my membership, you're getting a ton of information from me. So I appreciate. We've had actually 10 people join our membership just in the last couple of days. So you'll see a lot of information coming your way. And then technology tips. So client technology, mobile device, landline phone, laptop, computer, tablet. You need to know what they have. Computer technology, or I should say provider technology, laptop, USB, computer, phone, what kind of platform? Is it encrypted? Is it scalability? Is it reliability? What's the ease of use? That kind of thing. So make sure you're getting in touch with your IT people. Make sure that the patient knows it can't be public-facing platforms. What does that mean? Okay, so FaceTime and Google Duo is for Androids, and you've also got Skype options for iPhones, etc. Video communication applications that are public-facing should not be used in the provision of telehealth, and they've actually said it in the waiver of the Social Security Act. That is Facebook Live, meaning that anybody can log on. Twitch is another one. You've seen that new thing, TikTok. I think some of these things are crazy, but I'm old school. But when you're dealing with this, those things are not appropriate. And it's been very clear that you have to say what kind of telecommunication that you're using. If the patient's just on the phone, just say this is a telephone call. If the patient's on FaceTime, say what that is. But you have to say it within the record. So that is going to be checked, because they're going to check for good faith. They're not going to check for how you coded it unless they suspect fraud, abuse, or bad faith. And so that just basically means they are going to check. I mean, let's face it, they can find anything. So how about use for phones for telehealth? Okay, so many of the functions that were previously conducted on computers are now being done on the phone because of their convenient, portable, and the patients typically have some kind of a phone. So using phones for telehealth, you really want to have something in your office that has something that enables the user to have authentication. So make sure that it has a PIN or a password or a phrase. And some, smartphones have fingerprint scan. I know that's what mine has, to be able to get into the phone. So, and it should have some kind of multi-factor identification, just because it keeps it even more private. So try to, and secure. What if that phone is stolen? Some of that information is saved. So you have to be really cognizant of that. And then using phones for telehealth, minimize background noise. Try to remove audible distractions from the room, such as televisions or pets. Consider using a white noise machine to cover household noises. And this is what you want to talk to your patients about. Make sure that your phone is charged or plugged in. Always tell your patient that. If you're going to use the telehealth option, can you just make sure that your phone is fully charged? And then while it's not necessary to wear headphones with a microphone for non-video calls, it does allow clinicians to have clear audio, as well as protecting the privacy of your patient. So I would strongly recommend that you use some kind of a headphone with a microphone. And then greet your clients as you normally would. And then how to conduct telehealth by phone. So first of all, make sure that the client is safe. If there's no video, verify the name, birth date, and address of your client, and it needs to be documented. Explain the goals for today's visit, and then you proceed as if the patient was in the room with you, but you need to document time, a consent to be seen, and then also make sure that you're saying this is a phone call only, because you're only going to be able to bill for some phone calls. And then general telehealth etiquette for providers. Be prepared and on time for your scheduled appointment. This isn't like on, in person where, patients can read a magazine, and a lot of times they converse with people in the waiting room, not too much, but sometimes they do. Or there's TV on in there. There's distractions. And yes, there may be distractions at home, but if they're expecting a 5:00 call and you're later than, 5 minutes, they're going to go say, well, I'm going to go eat dinner, or they're not calling, or then they're going to call your office, and you could be calling at the same time, and it just becomes a mess. So this is a great way to really time manage. And then ensure privacy to the extent that's possible. And again, eliminate or minimize background noises. Do not eat or chew gum, and do not answer other phone calls or text during the same session. If you take notes during the session, let the client know that you're taking notes about their session so that they don't think that you're not paying attention or responding to email or text from another patient or something that's going on in the office. When you are on a telehealth call, whether it be audio, visual, or just a phone call, it should be just about that patient. Otherwise, do not bill for it because you are not doing that at any other time. So it needs to be just as if you were in the office. It's just about that patient. Now, telehealth with video. Some simple tips before your session starts. So if possible, try to plug in directly to the Wi-Fi router for better connectivity if you can. Silence your cell phone or landline. Ensure that sessions take place in a private location, so a home office or a room with a door, and providers should not see clients from their bedroom because you want to maintain professional boundaries. And then try to use a technology platform that's encrypted if you can. Also, take a selfie or look in the mirror and make sure your facial image is positive. If you've had a rotten day, don't be doing that. Make sure that the computer is at eye level for the video. Okay, this is not a rap video. This is a patient that you're talking to, and you need eye level. I saw a couple videos that actually kind of were a little bit amusing to me, where the patient was so close. It was the big head moment. So try to make sure that you're not having a big head moment. But check camera in camera to see what the client will see in your background as well. So flip it around. The background should be neutral. And then to create the space, consider using an adjustable screen or a divider behind your chair. Dress appropriately for the session. Business casual suggested. Also recommend that clients be dressed appropriately. Have any tools such as assessments, evaluations, or any kind of take-home items ready for the session, just because they're going to have things they're going to have to do as well. And then what will the client see and hear? Okay, so here's something that you have to be really cognizant of virtual check-ins. So just make sure you're aware of that you just need to be as professional as possible. So for virtual check-ins, you ask the patient, are you willing to be seen via telehealth? Are you comfortable using telehealth? Do you have access to a phone, tablet, or computer? This is where somebody's getting ready to talk to the physician. The type of device available to the client will allow you to know in advance if this will be video or non-video. That should be determined before they even talk to the physician or provider. Is there a private place in your home with a door where you can have a session? If not, is there a place you will be comfortable talking via telehealth? And will anybody else be in the room with you? Now, a brief check-in with a client via telephone or other communication device. And again, you put down what kind of device it is. For client verification, you need to collect that name, address, and birth date. And then client session. Okay, so here's what you really have to have. During the PHE, and again, that's public health emergency, verbal consent is sufficient, but it has to be documented. If there is a video, your client or your patient cannot be sitting or laying on a bed. You need to maintain boundaries unless it's a hospital bed or unless it's a patient that is bedridden. And if it is, you need to make sure that you're documenting that in your information. A patient can say they're not recording. You wouldn't know. They could be recording. So you have to make sure for boundary issues that is not the case from a routine standpoint. And then track session minutes for billing purposes. I'm seeing more and more, and there was a little hidden note in the last March 31st information from Medicare that said that visits, if you can time them, they would prefer it. So make sure that you're putting information in there for timing that information. So again, talking about just place of service and all that kind of stuff, you can find that on the webinar. I just wanted to give you some updates or tips on how to deal with it from a patient perspective and a client perspective to how to deliver that information. And hopefully you found that helpful. Okay, our coding question. I do have one coding question when it comes to telehealth. And this comes up every day, no matter what I've sent everybody, no matter what we're talking about. It seems like we're beating a dead horse on this, but I'm going to go ahead and respond to it only because it has changed over the last couple of weeks. There was actually a consultant on one of the social media platforms, LinkedIn, and he had put a video of himself talking about all the telehealth, and he said that you can bill a office visit for an audio-only phone call to Medicare, and that is absolutely 200% inaccurate. So do not do that. Now, the question says, Terry, can we now bill a regular phone call with no video capability or for an elderly patient who does not know how to work her FaceTime or Skype video chat as an office visit? The answer is no. No, you cannot. You need to use CPT codes for phone visits, 99441 to 99443, for physicians or qualified nurse practitioners or PAs, qualified healthcare professionals, or 98966 to 98968 for non-physicians, but still qualified. So this would be clinical social workers, PT and OT therapists, things like that. Not RNs, not LVNs, not medical assistants. They're not allowed to code for them anyway. Now, on the phone calls, there's still that 7-day rule where it can originate from a previous visit, and you're not asking them to come in for the next available, and consent and time are needed because they're all time-based. But just remember, you cannot bill an office visit unless you have that video. The reason is that it's called an interactive audio visual service, meaning that the patient and the physician can see each other and talk to each other. I had a question this morning. It said, Terry, the patient doesn't have video but wants to send me a photo of themselves. Is that okay? No. A photo would be called asynchronous communication, telehealth. This is synchronous telehealth, so it's not just a text or a video. If you're just getting a video, that's G2010. If you're just having a phone call to see if they need to come in, that's G2012. That's just a virtual check-in. But if it is a phone visit, audio only, then that is a phone call, and that's all based on time. So make sure you take a look at that. What's interesting with this with Medicare is they didn't pay for it, the phone calls before March 30th, and then they came out with this on March 31st, saying it was retro to March 1st, but they're not even on the fee schedule yet because the Federal Register said that they'll be effective April 6th. So just know, do it from this point on. April 6th is when you can get a phone call. I wouldn't go back and try to bill for it. Our coding question was brought to you today by telemedicine.com, your single resource for telemedicine. Telemedicine.com since 2010. Also, WHA, Women in Healthcare Administration of Southern California, whasocal.org. Join me for a free webinar, on April 21st at noon Pacific time on the healthcare job market in these changing times. So just wait so you can see what I have on that list for potential job opportunities for you. If you're thinking of changing careers, if you're thinking of opening up a new title, such as the one I mentioned, the telehealth coordinator, all kinds of things going on. You can find that on eventbrite.com. Okay, so I wanted to end with a little known fact about me. I'm really not awed by celebrities. Unless it's a professional football player, it just doesn't impress me at all. But I do love the Duchess of Sussex, Meghan Markle and Prince Harry. I don't know why, but ever since I heard her in an interview when they were engaged, I just love them together. She's just such an intelligent and thoughtful person. She makes Harry better, and I always love women that make their partner better. But she's just, I just love them as a couple. But she is narrating a show on Disney Plus that starts today called Elephants. And it's Earth Month, so if you didn't know that. And so there's another show on Disney Plus called Dolphin Reef. And they're two documentaries about those two animal families. So let's face it, you've got the time. And if you have young kids or even adult kids like me, enjoy a Disney show that's not really an animated show or one of those really dumb reality shows, but some great insight into these great animal families. And it's also streaming on Hulu. So anyway, hopefully you'll check that out. Also, don't forget to check out my new podcast, The Business Collective, on all platforms, and leave me a rating and review and hit subscribe. It dropped on Monday and will drop every Monday. So Mindset Monday. And again, it was just so fun to really just get this going for those of you that want to go from employee to consultant or employee to entrepreneur. And I've had so much feedback from so many of you. Thank you for that. It's just been so positive. And I just want you to be inspired to just do it. Go for it. And remember, it's a journey, not a foot race. And I'm so excited to help you get there. So hopefully you'll check that out and be excited. And I am going to get my Bun Life podcast back up. That's just me having a good time. And that's really fun. We're actually working on a couple episodes right now. I'm figuring out some new music, but we're getting that up now that we've got some time to do it. So everyone, on a Terry Tuesday, make it a great day, make it a great week. And thank you for listening to the CodeCast podcast. The CodeCast podcast. The CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.